Earlier this week here on 21 News at 5, our local infectious disease specialist, Dr. D. Banks, told us that the death of an unvaccinated child in Texas was the first measles death in the U.S. in 10 years. That death, coupled with cases cropping up in more and more states, has parents and health officials concerned right now. Here to help us get some answers is Akron Children's pediatrician, Dr. Therese Lennon. Dr. Lennon, what concerns you the most when you watch the news reports regarding the measles outbreak here in the U.S. and you're getting questions from parents?
For sure. So what concerns me is any death from measles, because it is preventable. It is a vaccine preventable disease. So we have the tools that we need to stop it. And the fact that there has been a death in spite of that is very alarming.
In your opinion, is it more of a matter of when, not if, we're going to see measles crop up here in Ohio and Western Pennsylvania?
Oh, for sure. So we actually had an outbreak in the state of Ohio in 2022. That was down in Columbus. It wasn't that long ago. And measles spreads very quickly in the unvaccinated population. And unfortunately, the rates of unvaccination are climbing. So as we continue to see that, I expect that we will continue to see measles throughout our country.
Now, these reports have shed a light on the fact that measles presents itself with a fever and then a rash. So when should parents be looking for the symptoms when it comes to the rash? What would it look like?
So the rash usually follows about a 1 to 2 prodrome period is what we say, and that's that period of fever. It may start with something simple like a bluish white dot in the mouth. They're painless. So after you see those spots in the mouth, then you'll start to see a rash, and it usually starts around the face or the hairline. It is a red dotted rash, and it spreads from the hairline and the face down through the hands and feet and through the rest of the body.
What age do kids get the vaccine for it? And if you have just one dose, is that enough?
So the first vaccine is typically administered at 12 months of age, and then the second booster is given usually around 4. The first dose in and of itself is above 90% effective against a measles infection, but you can get up to about 97% infection prevention when we use both doses in conjunction together.
Okay, so parents with infants should be very concerned about this right now. And what would you recommend they do?
Between birth and 6 months, they still have immunity that is passed down from their mother. It's the 6 to 12 month infant that get a little more concerned about in times of outbreak. And as outbreaks continue to increase, that first dose may actually be administered as young as 6 months, but we're not there just yet.
Okay. It's also been pointed out measles is more contagious than the flu, than COVID. So how is it transmitted, and can it live on objects for long periods of time, like a desk or a tablet or a door handle?
Actually, yes. So it is highly contagious. It is spread through a respiratory droplet, so sneezing and coughing. And yes, so it's usually spread from person to person, but when a person who has measles is in a room, there are some droplets that can be left behind. And usually those linger anywhere between 30 and 60 minutes after the person who has measles has left the room.
Dr. Lennon, what do parents need to do right now if they do not have their child vaccinated against the measles?
I know that there is a lot of information out there about vaccines and the pros and cons of them, but I am imploring you, if your child is not vaccinated, please reach out to your pediatrician, or you can go on to akronchildrens.org, where there is accurate information about this vaccine and how to prevent this vaccine preventable disease.
All right, Dr. Therese Lennon from Akron Children's, thank you so much for taking the time to join us right here at 5.
Thank you.